My name is Amish Parikh. I'm an adult endocrinologist, and I have a large diabetes practice. As a physician, I'm excited because we can now offer patients another effective AID system. Automated insulin delivery is basically a system that has sort of three parts. The first part is the insulin pump. The second part is a continuous glucose monitor. And then the part that connects the two is an algorithm that allows for the pump to adjust the amount of insulin, either up or down, to keep the blood sugars in a safe range and to minimize the risk of hypoglycemia. Most of us who work with patients that have type 1 diabetes would now consider AID or automated insulin delivery as the standard of care for patients that have type 1 diabetes.
My name is Melissa, and this is my 3-year-old daughter, Alaiza. When she was diagnosed, I had no experience with diabetes. It was a complete shock for me. And to be honest, it flipped our world upside down. Being able to start Omnipod 5 is extremely exciting. Just being able to see Alaiza in range for longer periods of time is something that we've been looking forward to for a very long time.
AID technology simplifies having type 1 diabetes because patients then have better quality of life. They're less worried about their blood sugars going low. And most importantly, using an AID system reduces the risk of long-term diabetes-related complications.
I'm really excited to be starting Omnipod 5. I am excited to be starting an automated system, especially transitioning from manual daily injections. Knowing that it's integrated with my continuous glucose monitor makes me feel comforted knowing that living with diabetes will be a lot easier to manage now.
The Omnipod 5 system would fit seamlessly into a patient's daily life. It would provide them with a lot more flexibility than multiple daily injections. And it would also take away some of the emotional burden of having type 1 diabetes.
Having Omnipod 5 in our day-to-day life will mean that I get to give Alaiza less injections throughout the day. She can have those snacks that I didn't count for, that I would normally say no to because I really want her to stay in range as long as possible, but Omnipod will give her that sense of normalcy.
What I would suggest that any patient with type 1 diabetes would benefit from wearing a system like Omnipod 5.
I'd like to say to anybody caring for someone living with type 1 diabetes and thinking about starting Omnipod is just do it. Having them in range, it's so rewarding.
Omnipod 5 will definitely help me have better control of my diabetes.